The Global Fund to fight AIDS, TB, and malaria has become one of the most important funders to fight these big three diseases. But last year they hit some rough waters. What happened to sort of derail their momentum?
Well, they grew very, very rapidly. They're 10 years old. They went from zero to having almost $22 billion of resources pledged. They dispersed $15 billion very, very rapidly, and they got into trouble along a couple of different dimensions. One was weak oversight in the way the monies are expended. 40% of their dollars go through supply chains and procurement, which are vulnerable to fraud and diversion. So there's a major problem. Then you have fundraising and forecasting for donors. And we're into our third year plus of a global recession. Donor budgets started to collapse, and I think they were kind of slow to see that. Another problem was weakness in management. I think the team that was there wasn't really up to the task of managing this kind of complicated operation, and they needed strengthened management. Board governance was a little ineffectual. The board was far too inclusive. It had a difficult time making strategic decisions. It had a difficult time recognizing how much things had changed and how much they needed to really adjust their model of operations and be much more strategic and careful in how they went ahead.
Now, has the fund taken any steps to sort of address these concerns?
The really cataclysmic moment came at the end of the year when they had their November board meeting, when it became clear that they were going to suffer a $2.2 billion shortfall in revenue generation, and that really forced them into a kind of crisis mode decision making. And a lot of the planning and ideas that had been developed over the course of the year around reforming operations gelled into a transformation plan. So fortunately, when they hit the really tough times at the end of the year, a lot of the thinking around how precisely they wanted to change their modes of operations, a lot of that careful thinking had been done. It was really a question of getting the consensus within the board to embrace that and drive it forward. There was a change of management, a new interim head brought on, and their basic model was changed. So very substantial reforms are now in place.
Now, of course, the United States is the fund's biggest donor.
Correct.
What role can we play in sort of rebuilding confidence in the fund going forward?
The U.S. has contributed roughly a third of the resources, so the U.S. taxpayers have contributed over $7 billion to the Global Fund. Our leadership, the Obama administration leadership, Ambassador Eric Goosby and others have been very much at the forefront of pressing for reforms. That remains very vital. First priority is to make sure that the new management team that's put in place, because we have an interim manager, there needs to be a new senior level team, and they need to preserve and reform the way the portfolio managers operate. That needs to be a priority. The diplomacy and rebuilding trust and confidence among the key donors is going to be vitally important, because we cannot, as a government, cannot shoulder more than 1/3 of the total. Preserving confidence of Congress is going to be critically important, and that has been remarkably successful in very tough budgetary times, remarkably successful of late in the last 2 years.
Now, diving more into the budget scenario, yes. In the President's FY13 budget proposal that he delivered to Congress, there's an increase for the Global Fund. There's also a shift from sort of bilateral funding, right, from PEPFAR. Does this represent sort of a change in tack, a focus on multilateral as opposed to bilateral investment models?
In the last 2 years, the administration has committed $1.05 billion per year to the Global Fund, and Congress came forward at the end of last year in the FY12 budget and approved that level. Then the administration came in with its budget request asking that there be a transfer of an additional $250 million, bringing our contribution for FY12 to $1.3 billion, and then asking for $1.65 billion for FY13. Put that into context, President Obama committed during the 2000 2010 replenishment, 3-year replenishment for the Global Fund, President Obama committed to $4 billion over 3 years. So in one respect, you're looking at this and you're saying, okay, they're fulfilling their obligation. They're fulfilling that pledge that was made in 2010, and that's reflected in this budget. I do think that looking out over the future, it makes sense for the U.S. to be putting greater and greater emphasis on multilateral institutions as a lead element of U.S. policy. And the reason for that is that, first of all, organizations like the Global Fund and the Gavi Alliance, which is the vaccine instrument, these should be drawing higher and higher commitments from the partner governments themselves, as well as leveraging donations from other donors. So I think it's a better, in some ways, a better, stronger sale to the Congress and the American people, providing we have full confidence that we're getting the results that we want. And that gets to another point here. If we're going to put higher and higher support behind the Global Fund, higher dollars and higher emphasis, we need to make sure that we're using U.S. capacities on the ground in those partner governments to keep oversight of those operations and strengthen them on a technical level. And that's another thing to keep in mind looking forward.
So Steve Morrison's new report is called Writing the Global Fund. You can find it online at csis.org or smartglobalhealth.org. Steve, thanks for joining me today.
Thank you, Don. Thank you very much.